Okay, so who's tired of looking tired? It's one of the most common complaints I see in the office. People in their late 30s and on say, you know, everybody says I look tired, and I'm not tired, I'm full of energy. But it's the extra skin around the upper eyelids or the bags of fat in the lower eyelids that make people think you're tired when you're not. Well, the good news is, with a short little operation called a blepharoplasty, whether it's an upper blepharoplasty or a lower blepharoplasty, we can fix that. Let me show you this woman who's about 65 years old. Just looking at her eyes, no other part of her face, it makes all the difference in terms of how vivacious she looks, how alert she looks. And it's a simple procedure to remove the extra skin, tighten up the muscle around the upper eyelid, remove extra fat bags that have developed over the years, and bang, she looks terrific. To give you a sense of the timeline for recovery, this is 5 days after her procedure. She got no bruising. Now, some people will get bruising or may even get a black eye. Not likely, though. And this is 5 days after a procedure that removed that extra skin. And you can see that the skin is no longer sitting on her eyelashes. So evolutionarily, we're programmed to look at eyes. The eyes are the window to the soul. That's where we look. And you know from a cocktail party that if somebody's really talking to you but looking just a little bit off your shoulder, you know they're not paying attention. We're programmed through evolution to look at eyes. That's where all the action is. So that's the area of your face that gets the most bang for its buck. If we can improve that, the rest of you looks terrific. Scientific studies show that middle-aged women start to focus around their jawline and around their eye sockets, the periorbita, meaning the upper and lower eyelids. During a blepharoplasty, we correct these following layers: remove the extra skin, tighten the muscle, and remove the extra fat bags that have developed, and or redistribute them so they create fullness in the right areas and take away the puffiness in the wrong areas. A before and after of a upper blepharoplasty, that is the upper eyelids. A close-up showing that that incision just falls into the natural crease that we all have in our eyelids. That's a perfect place to hide an incision. This woman came from Corning, New York. She literally said, I'm tired of people saying that I look tired. With a short operation, blepharoplasty, improved that. She just looks alert and really is at her best. Many people complain that they can't put makeup or eyeshadow on their upper eyelids because the skin touches, the sort of eyebrow skin touches the eyelid skin. This was this nurse's complaints. She came to me for removing that extra skin and removing that extra fat. She came to our practice all the way from Brazil. And Brazil, of course, is a hotbed of plastic surgery, so she chose well, I think, and I'm really honored to treat her. Upper eyelids, we're able to do this awake, removing the extra skin, and she had a lot of extra fat. This is her at 1 week, still early in the healing process, and you can see that she's going to go on to have the result that she always wanted. She flew up from Florida for upper and lower eyelids, and you can see that this is just 1 week. Yeah, she's bruised. Yes, the sutures are still dissolving, but she's already headed to the result that she's wanted. And around the DC area, we call this the C-SPAN effect or the HDTV effect. People are like, hey, I was on C-SPAN. We're like, yay, yay. But they said, you know, because it's high def, I saw every little blemish and every little fault. Either people said I looked tired or I looked angry. I want to fix that. Many different causes for dark circles. It may be related to hyperpigmentation, or as the skin thins out, the venous blood underneath it shows through. Here's a list of the causes of dark circles. The best results we get are in those that have thicker skin, that have a more defined hollow, or have a better coloration of the skin. People also identify this tear trough, or the sort of this cheetah mark that hangs out right underneath their lower eyelid. And there are gradations of that as well, from mild to severe. For some, we may be able to do just an off-the-counter injection of a filler like Juvederm or Restylane. Others, we may do fat grafting. And fat grafting has some virtues. Because it's yellow and it's your own fat, it can hide the venous blood a little bit better. But fillers are nice and convenient. You can do it just during your coffee break. And there are others, of course, that need surgery. We want to identify the simplest mechanism of solving that problem for you. In other words, if you can get away with just an injection over your coffee break, let's do that. But if you need fat grafting, let's do that. And if you need surgery, let's not kid ourselves that you're going to need surgery at some point, but let's identify the least invasive way in which we can get you the result that you desire. Here we have a depiction of just lots of extra fat bags in the lower eyelid, lots of shadowing. This is about 1 month later, and you can see just a nice contour and elimination of the dark shadows with a lower blepharoplasty by removing the extra fat, but then also treating that tear trough and improving that. You may be uncomfortable looking at this slide. This is what we do day in and day out. This is a lower blepharoplasty. There's no external scar in this approach. It's done from just inside the lower eyelid to help remove that fat and smooth out the contours and even out the tear trough. Perfect example of removing the extra fat bags from her lower eyelids. Let's look at a before and after from several views of a young woman always bothered by the fat bags under her eyes. She said she's had them ever since she was a teenager, so it wasn't related to aging, she just always had them. And as you see from those views, and now looking at her front-on view, nice result, looks relaxed, looks comfortable, and doesn't look fatigued. Well, what causes this? Well, I mean, there's so many things that go on in modern living, whether it's not enough sleep or too much screen time, or staying up late and studying. Any number of those factors are contributing to us looking tired. The nice thing to know is there are treatments and options that help improve all of that. This patient came to me wanting an eyelid lift. However, I told her that her eyelids are fine. What she really needed was an eyebrow lift. So in women, we like the eyebrow to be above the bony ridge of the eye socket, and we like for it to have a nice gentle arch at the junction of the inner 2/3 and the outer 1/3. In men, we want a straighter eyebrow that sits right on the brow bone, but in women, slightly above. So her issue was really that she needed an eyebrow lift. So as I look at you in the office, I'm able to analyze whether you need a brow lift or an eyelid lift or a combination of those to get to the results that you seek. The way a brow lift is done nowadays is with a camera or an endoscopic approach, where we make small incisions behind the hairline so they're hidden, and with a camera remove any over tight muscles, remove any extra fat, and elevate and fixate the brow to an appropriate location. This is done with a device that I commonly use called an endotine. It's basically like a little dissolvable carpet tack that we put into your forehead and lift up the eyebrow and pin it to the correct location. I published a scientific paper back in 2008 about eyebrow aesthetics, meaning what are the things that I as a plastic surgeon and society at large look at in terms of saying, I like the shape of that eyebrow. And I use this to inform my decision making as I evaluate you in the office and perform your procedure. Feel free to download our app. It's called Mod Your Bod. It teaches you about our practice, lets you know about me, lets me know about the things that you want to improve. Send us an email, send us a contact. We'd love to look after you. Thank you very much.